The foot and ankle injuries. We see a lot of these. If you look at the picture on the bottom, you can see what a sprained ankle might look like with the discoloration around the ligaments. And if you look in the upper picture, you can see that the poor football guy is probably having a dislocated ankle right there. So we're going to talk about foot and ankle injuries. It's really important that you understand the basic anatomy of this joint and the foot, the ankle. There are two major bones of the lower leg. The tibia is the bigger bone, and the fibula is the smaller bone. Then you have the tarsals and the metatarsals. It's important that you know where these bones are located. You don't have to know each name, but where they're located. We're going to study the ligaments, and we're going to study different injuries that happen at this location. If you look at the bottom of the foot, you see there's plantar fascia. We're going to talk about fascia later on, but the plantar fascia is on the entire bottom of the foot. Injuries happen there to runners, to people that are on their feet a lot all day. And what they have to do is they have to roll it out with a lacrosse ball to lengthen it out. And you can see where on the heel is where most of the torque is, and it usually will tear there or become very irritated. So we can tape it and we can stretch out their calf muscles. Turf toe, we already talked about it. You can see this is the location. This is how you treat it. A fractured toe usually happens because you stub it. If you look at the x-ray on the right-hand side, you can see the bone is broken. You can't really cast it. The only thing you do is you tape up the digit, and then you buddy tape them together so that it's stabilized. And then if they can tolerate running, they get to practice. If you look at the x-ray on the left, on the very left side, you'll see these two round little bones. They're sesamoid bones. They act as levers. And then if you look on the right, you can see there's a soft callus forming around the bone where the black arrow is. And that's indicative of a healing fracture. It's a stress fracture. You get these kind of foot fractures when you're in the military service because you have to do a lot of marching. And you can also see on the other x-ray that the heel has been fractured here. Usually that's from a fall or something, or you jumping down from something. And you can see they've had to have it pinned. Here is on the x-ray, you can see that there has been a fracture of the base of the fifth metatarsal. This happens most often in athletics. This is the place, the fifth metatarsal is where you get a fracture in the foot. And an avulsion fracture is the best kind of fracture to get because it gets pulled off by the muscle so that if you immobilize it and put it back in place, it'll heal up nicely. You don't have to have surgery or anything. This is a dislocated ankle. You can see that it fractures the fibula, tears up the ligaments, and causes general pain and suffering. Fracture blisters happen sometimes, not very often. I've seen them a few times. You just have to manage them and make sure they don't get infected. Lisfranc injury is an injury that happens to your forefoot. It can happen in the picture here with the football player getting his forefoot sprained. It happens in soccer quite a bit where someone steps on your foot and you go to pull it away and you get an injury there. This is one of the most missed injuries you can see. I've had a couple of them in men's soccer when I was at Boston University, and they're painful and they take a long time to heal. Shoes. Nike sucks. That's all I can tell you. Nike sucks. People buy Nike because of the way they look, the colors, blah, blah, blah. But they are a piece of garbage. If you want to have a good shoe, go to Marathon Sports in Wellesley. They have qualified people that can look at your foot structure and match you with a correct shoe. Brooks or Asics are good. As far as cleats go, wearing the Under Armour cleats that look like a sock, they are nasty, wrong, stupid. All right, so we will go over a whole thing on shoe selection. I'll give you a handout. Ankle injuries. There are three basic types of ankle injuries. One is inversion. That's the most common, and you hurt the injuries on the ligaments. Ligaments on the outside of the foot. The other one is an eversion sprain where you twist it outwardly and you can get a tear there. And the third and the worst type is a high ankle sprain, or what we call syndesmosis. You can split the membrane that holds the two bones together. Gronk is one of the athletes that suffered this injury a few years ago, and we'll take a look at his um, YouTube video in a little while. Achilles tendon inflammation. This is something that is people tear it all the time as they get older. They don't work out enough. They don't stretch enough. They don't get warmed up enough. They go out and they'll play a game of basketball and it tears. It goes up like a shade. So if you want to avoid this, young kids get it too. You have to roll out your feet to stretch out the fascia on the bottom, and you have to stretch out your calf muscles so that you don't get this Achilles tendon issue. Dislocated ankle usually results with a fracture. When I was at Boston University working football, I saw 3 of these. They were nasty, always ends up with a fracture and surgery. This is what a surgical repair looks like. You can see that the bone was broken and that they had to go in and put hardware on both sides of the ankle to stabilize it. The picture on the left of the football player shows a dislocated ankle in football, and the one on the right shows the dislocation of a basketball player. So look at the websites, do the reading, and we're going to have discussion in class about this. So let's see if I can turn this off.